Hello, everyone. My name is Solomay Tibabu. I'm the director of the Upswing Fund for Adolescent Mental Health, and I'm so excited to be here with Teresa Halliday for another session of Ask the Expert. Teresa, how about we get started by introducing yourself, please?
Sure, Salome. So my name's Teresa Halliday, and I serve as Senior Director of Practice Improvement at the National Council for Mental Wellbeing, where I focus on issues of mental health and substance use, particularly in youth. And my background in anthropology really helps me to take a cultural perspective on health and wellness. The National Council is also home of mental health first aid. We've trained more than 2.5 million people in the US to identify, understand, and respond to signs and symptoms of mental health and substance use challenges.
Excellent. And you've done a lot of work with youth mental health. Can I ask you first, what is the Youth Mental Health First Aid Program? And more about that, please.
Sure. Youth Mental Health First Aid is an evidence-based program designed to teach parents and family members, caregivers, teachers and school staff, neighbors, health and human service workers, other caring adults, how to help an adolescent who's experiencing a mental health or addictions challenge or is in crisis. So it's primarily designed for adults who regularly interact with young people. And the course introduces common mental health challenges for youth. It reviews typical adolescent development, and it teaches an action plan for how to help young people both in crisis and non-crisis situations. So it covers topics like anxiety, depression, substance use, disorders in where psychosis may occur, and disruptive behavior disorders, including ADHD, as well as eating disorders. Trainings can be taken virtually, in person, or in a blended format. And I'd like to also share an exciting related program, Teen Mental Health First Aid. It's a similar evidence-based training program that teaches teens, that's grades 10 through 12, also how to identify, understand, and respond to signs of mental health and substance use challenges amongst their friends. So it gives teens the skills to have supportive conversations with their friends and get a responsible, trusted adult to take over when necessary. It's delivered in schools and community sites, and right now it's being implemented across 47 states as well as in Guam. Evaluation results have been strong. They show that teens who have taken the training have an increased willingness to help and encourage their peers to speak with an adult about concerns. They feel more comfortable asking if a friend is thinking about suicide. And it also has shown that during the COVID-19 pandemic, more than half of teens trained reported that they had encountered a peer experiencing a mental health challenge or crisis, and that most of those teens, 88% in fact, reported using their TMHFA skills to help their peer. They're also using it to help themselves, to help them manage their own stress and seek help when they need it. So this and similar resources are more important now than ever.
That's amazing. What an excellent program for teens, adults, and your scale already is remarkable. And so can consumers find out more about this on the website, or how do they get involved?
Absolutely, yes. All of the information is available at the National Council for Mental Wellbeing website, as well as through Mental Health First Aid.
Fabulous. And that's not the only youth and adolescents program that you have. Tell us about the Connected program, please.
Absolutely. Connected was a 2-year initiative with the goal of reducing the impact of anxiety, depression, and suicide among young people in underserved communities, while empowering youth to also engage in meaningful community change. So together with a team of national experts, the National Council launched a learning community that supported community-defined evidence and practice and youth voice to increase access and engagement in quality, appropriate care for culturally diverse, rural, LGBTQ+, and other youth populations that experience barriers to mental health supports. Each organization implemented an approach that they identified. It was not prescribed by the national team. They tailored to their own community based on their inherent knowledge of what's needed and what works for those that they serve. So we invited 5 community-based youth-serving organizations, and they spanned behavioral health, school systems, employment training organizations, and community task forces, and 20 young people in those communities to receive training and technical assistance to develop meaningful partnership, enact adaptive and technical leadership, and spur collective change through advocating for, implementing, evaluating, sustaining novel youth-led practice. Our youth participants took part in a customized program to strengthen their leadership and advocacy skills and help to make decisions about the systems and supports that affect them. And a great benefit of this work for the National Council was the ability to build our own capacity to incorporate youth voice into our own planning and programming. The Connected team right now is busy compiling all of the lessons learned and helpful resources into a website that captures the key strategies that Connected young leaders and community-based organizations applied in order to foster those meaningful partnerships successfully to improve youth mental well-being. And it's designed really to inspire as well as facilitate other communities as they embark on similar journeys of creating those effective youth-adult partnerships for transformational change. So look out for that later this year.
Another amazing initiative by the National Council. Super exciting. You did allude a bit already to why working at the community level is so important when talking about impacting youth mental health, specifically for LGBTQ teens, adolescents of color. Anything more you can expand on that?
Sure. We were really fortunate with Connected to be able to elevate practice that's driven by community-defined evidence. Because while there's a wealth of strong evidence-based practices out there that are empirically proven to be effective and they do garner funding that's desperately needed to provide services, they're commonly developed and tested amongst the dominant culture. And it also takes significant time, effort, and money to create and test and publish those evidence-based practices. These are things that many community-based organizations just don't have in excess, yet they're creating great impact in their diverse communities, doing what they've tested over time and what works for the people that they serve. The community's definition of illness and wellness is shaped by culture, by historical and social contexts, and these elements really can't be ignored when it comes to providing the most appropriate services for LGBTQ youth and youth in communities of color. To be most effective, programs and services need to be grounded in that lived experience of young people, especially those who are historically underserved. So, when policy and planning continues to exclude the people that it intends to serve, it perpetuates exclusion and systemic oppression. And it's well documented that provider bias, both conscious and unconscious, and a lack of cultural responsiveness can result in misdiagnosis and inadequate treatment. So we're reminded that youth really are the experts at the table and that they need to be invited, heard, and really raised up as leaders in order to access that truer understanding of the problem and the possible solutions. So by sharing power in decision making, organizations can really empower young people to channel their voices of their experience and to find new, more inclusive approaches to improving systems of care for young people.
All of the things that you said are so important. And as you know, as an advisor of the Upswing Fund, we definitely embrace a number of those facets in the work that we do as well. So really appreciate you highlighting that. So the Connected program has been underway for a while. Any interesting findings from the communities you've partnered with that you'd like to share?
Yes, absolutely. There are interesting findings. I think one of the most significant for the communities and for ourselves was how crucial that early youth adult relationship building phase was. So often funding streams require that organizations implement at full speed right from the start, but it takes time to develop the vulnerability, authenticity, and the mutual trust that's required for effective partnership between young people and adults. And it takes time to design together, to co-create innovative solutions to better serve underserved youth. And so we were able to offer the flexibility of time and of funding that our organizations really celebrated. But out of 260 applicants, we only got to work with 5. So there are so many more out there that can benefit from this type of flexibility. We also saw that all of the capacity building work of the organizations was elevated by youth involvement. Youth became core members of interdisciplinary teams. They informed more than just their connected projects. They helped to create new processes to identify needs of the wider local youth community, to raise awareness about the available resources, and even to help create referral pathways to meet those needs. And when the pandemic hit, our organizations were better positioned to be nimble and swift in response to the new and changing community needs. Finally, we found that prioritizing adaptive leadership, cultural humility, and diversity, equity, and inclusion efforts with increased commitment by the organizations, we saw an increased sense of civic engagement and belongingness measured amongst youth participants. And that, of course, ultimately can have a positive effect on their mental well-being and resiliency.
Really great points across the board. And of course, one important one that we like to highlight frequently is that role of youth leadership, that they're at the table designing the services that that we're looking to help impact them. So wonderful to hear that. It sounded like there were some mentor organizations that were involved. Can you talk a little bit more about that? I thought that was pretty unique.
Sure. Yeah, one of the very special aspects of the learning community model is the peer-to-peer learning, the power of the cohort of participants. And by bringing in mentor organizations, we were able to enrich this value through highlighting the experience of organizations that have already seen great success in their youth-led programming. So our mentor organizations were available to our less experienced connected organizations to support in common challenges and creative solutions. And whether those were technical, such as how to better engage youth in virtual meetings during a pandemic, or adaptive challenges that related to organizational shifts toward a youth-led culture.
Awesome. Well, I'm sure there are so many more super interesting details and learnings from all of these experiences that I only wish we had more time. But I guess if I had one question left that I could ask you, what advice do you have for other communities looking to do something similar?
My first piece of advice would be prepared for change. You may not need to completely change the services you provide. There might be levers for refinement that youth can help to identify. But do prepare yourself and your organization for a culture shift, to question your norms and invite innovation. This goes beyond physical infrastructure and opening hours. Prioritize organizational buy-in so that bureaucracy doesn't restrain potential. And be prepared to be authentic and vulnerable with your youth partners. It's a non-negotiable for meaningful partnership. Be flexible, invite youth into the process as early as possible and engage them by leveraging their personal strengths, adapt to their preferred communication style, and respect their competing priorities and the life transitions that they're undertaking. Don't pressure them or expect them to have all the answers to fix the problems that exist. Instead, give them opportunities to inform and make decisions about those systems that affect them. And of course, elevate the voices of underrepresented youth. Prioritize creating pathways for care for young people who have inequitable access and disparities in outcomes. And finally, look out for those connected resources available on the upcoming website. They'll combine a whole lot of excellent resources for organizations and youth alike to empower one another for collective change through meaningful partnership.
Awesome. I can't wait to look into more of those resources. What a great initiative and experience for all stakeholders. And thank you for taking the time to share your expertise. Really wonderful having one of our esteemed Upswing advisors, Teresa Halliday, here with us for our Ask the Expert series. And thanks everyone for joining with us. And thank you, of course, Teresa.
Thanks so much, Solome. Always an honor to work with you and the Upswing Fund.